and they found that there were actually no studies on BCAAs that looked at oral BCAA ingestion and then subsequent measurement of muscle protein synthesis. Yeah, so I guess BCAAs is a pretty good place to start. We'll start with the different building blocks of protein. BCAAs are typically very high in leucine, and there's actually not a lot of data on this, despite a couple of early studies that seem to promote this idea that you retain more lean body mass while you're losing fat. That specific paper was actually challenged by a group. They wrote a letter to the editor, which I thought, I love to see scenarios like this where people are critiquing the literature.
Yes.
And the placebo group in that trial actually lost more weight than the BCAA group. And as a result, they had a decrease in lean body mass. So it wasn't necessarily that the BCAAs were preserving any lean mass. It was the fact that these people were eating essentially an isocaloric diet, lost something like half a kilogram, I believe, whereas the other group lost like 1.5 kilograms over about an 8-week time period.
Yeah, you got to keep track of those darn calories. That's going to be a recurring theme among these studies on various different proteins, is that it is a confounding variable that is often unaccounted for, even in the scientific literature.
Yeah, and a statement that was put out, a study that was put out in the International Society of Sports Nutrition, or a similar group to that, they actually in 2017 did a literature review, and they found that there were actually no studies on BCAAs that looked at oral BCAA ingestion and then subsequent measurement of muscle protein synthesis. Now, there were some studies that used intravenous infusions of BCAAs and the subsequent muscle protein synthesis, and those actually showed a decrease in muscle protein synthesis, which is really interesting because you're literally putting more amino acids in the bloodstream, but you're not getting the hypothesized or expected effect. And it seems like this was due to sort of a dilution of the essential amino acids. So you have more of the non-essential amino acids proportionally, and then your rate limiting step is going to be the essential amino acids.
Yep. This was a very surprising result, and props to the authors of this article for publishing it. Maybe one analogy we could put for this is it's like dysbiosis of the gut, but for protein. So the BCAAs were overcrowding the beneficial other EAAs. BCAAs are, of course, kind of part of EAAs.
All right. So BCAAs really haven't panned out as well as people have thought. And I think that the nutrition and sports performance community has sort of came around to this. I think there are some studies showing that maybe there's a decrease in muscular fatigue or muscle pain, but that's not necessarily translating into performance improvements. And I think that may be confounded or misinterpreted because essential amino acids have been shown to have this effect where you have less muscular fatigue. And the essential amino acids are a little bit different. I still don't think that there's a ton of upside for probably the population that's using them the most. Young, healthy individuals trying to put on lean mass, which I think is probably their biggest demographic if you looked at the sales.
Yeah, maybe a rule of thumb is if you're already consuming 1 gram of protein per pound of body weight per day, EAAs probably are not going to help as much. But if you're in the 80 to 90% of the population that is not doing that, perhaps they would benefit you.